Okay. So, welcome everybody. I'm Laura, Field Doctor's Dietitian, and I've got the pleasure of chatting with Joanna today, who's going to be sharing her experience on heart health. So, the reason that we're doing this is that February is Heart Month, and this is a campaign that sort of lasts all month to raise awareness about heart health. Now, in the UK, someone loses their life to a heart or circulatory condition every 3 minutes. This is a really sobering statistic, but the good news is that many cases of heart disease are preventable through lifestyle. And that's why today we're speaking with Joanna to learn more about what we can do to look after our hearts. And we're going to be focusing a bit on female heart health as well. So I'll tell you a bit about Joanna. Dr. Joanna Abramik is a senior specialty registrar in cardiology in the Bristol and Bath area, and she specialises in the management of coronary artery disease. She's currently undertaking her doctoral research into the effects of exercise and diet in people with coronary microvascular dysfunction. I hope I said that right. A condition which causes chest pain due to problems with the smallest vessels in the heart. She's really passionate about improving diversity within cardiology by improving opportunities for women to take up careers in the specialty, which may in turn be beneficial for patients. Joanna, welcome. Thank you for giving out your time
Much.
today.
Thank you for having me. I really value the opportunity to share my experience with you and my research. Thank you so much.
Brilliant. So, why don't we start there? Could you tell us a bit about yourself and your research in heart health?
Sure. As you read from my bio, I am a specialty registrar in cardiology. I was probably about 14 months away from becoming a consultant specializing in interventional cardiology. So it's a branch of cardiology looking after people's coronary artery disease. Where I've decided to take a step back and go into research and
Mm.
research a little bit more about the management of a specific type of coronary artery disease called microvascular dysfunction or coronary microvascular dysfunction. Um, and there's plenty of reasons for why I wanted to do that, but one of the reasons was that there isn't really any specific treatment for that particular condition,
Mhm.
and it tends to affect women a bit more than men. And there just seems to be quite a lot of differences in how it's being managed in comparison to other cardiovascular conditions. So the actual project is a randomized controlled trial of high intensity exercise and dietary rehabilitation regime, which takes 6 months.
Okay.
And we check people's angina. So angina is chest pain
Mhm.
scores before and after the intervention, as well as some more objective measures of how well they have improved functionally and how well the heart perfusion, so how heart blood flow had improved over that period of the 6 months. So it's a really well designed study. It's a third
Mm.
iteration of a very similar project that my colleagues had previously implemented in the Bath and Bristol area. Um, and it's had really good effects in other health conditions. So we are hoping that this will be equally just as beneficial for people with microvascular dysfunction. And those people tend to be slightly marginalized actually in terms of their overall management. So it's a good opportunity for these people to take part.
Amazing. When does the trial start?
So the trial has opened in November, and it will be open until sort of August 2026 for recruitment. So we are interested in recruiting people who have been diagnosed with coronary microvascular dysfunction on the basis of tests that were performed as part of their usual care. And then they are recruited from the Bath and Bristol area into the trial. So yes, so I'm very excited about this project. It's really one of the things that
Sounds really interesting. So can you tell us a bit about why heart disease is such a significant issue?
I think you've summarized it really well in your introduction. So heart disease is the leading cause of death globally and in the UK. In the UK, as you said, exactly, somebody dies from heart disease every 3 minutes. And exactly as you've said, there's lots of factors that can actually be modifiable in terms of your risk factors to prevent you from developing full-blown coronary artery disease, for example, or any other cardiovascular disease, really. So there's a lots of talk about it being genetic, but actually, even if you've got those genetic factors, there's still things that you can do to improve your overall cardiovascular health. So obviously, it's the things like hypertension or hypercholesterolemia, so high cholesterol levels,
Mhm.
smoking, poor diet, obesity. All of these are unfortunately related to our modern lifestyles, and unfortunately, with the modern lifestyles being the way they are, things are only going to get worse. And you can see what's happened in the US, and this is only coming our way, unfortunately. As I sort of said, there's often a silent phase within cardiovascular disease where you don't even know that you've got a problem unless you
Mm.
look for it. And lots of damage is being done without the individual actually noticing until it results in a catastrophic event, like, for example, a heart attack or a stroke. And once you get to that point, well, then you start to require lots of input. It becomes a chronic condition. So you need lots of input from your GP, from your cardiologist, from other specialties within the hospital medicine. And then there's lots of interventions, lots of medications, and it becomes really expensive to treat, both for you and also for the whole population, looking from sort of health economic perspective. Um, so it's the direct medical costs associated with all the treatments that we provide, but also the fact that there will be some loss of productivity from a particular individual who's affected by this because of their ill or perhaps premature death. So all of these factors, they are really important from both the individual and as I said, a sort of more population perspective.
Mm.
Um, and what I find actually is because of the poor risk factor management in the earlier lives, more and more younger people are being affected by those most
Okay.
debilitating forms of cardiovascular disease. And that causes profound effect on the quality of life and the family life and how the rest of their life looks. So it's really important to try and capture it early.
Yeah, and do those things early. As you said, it's because it's you have that silent phase. And I think when you think about heart disease, in my mind, certainly it's associated with kind of people who are older, but it's that
Completely.
interim period that it's obviously building up until you get that event. So,
Exactly, exactly. And we're going to talk about that in a minute, but there's lots of things, particularly in women, that go completely unnoticed, completely underrated, that then eventually result in a more profound event. So it's important to know about those things.
and do you think with the people that you see or come into contact
Mm.
with, do you think people really understand like the significance of lifestyle?
So I think there will be some people who do recognize that, and they do take a more proactive approach to their
Mhm.
health. And I think, those people genuinely end up being quite unlucky if they do present, for example, with a heart attack.
Yeah.
But there's a lot of people who just have no clue. And there's also a lot of people who do have an idea, but they haven't taken those proactive steps, like, for example, stopping smoking or looking after their cholesterol or looking after their blood pressure. So
Mm.
I think, people are different and people will have different attitudes to managing those sort of unknown risks.
Yeah.
But they are risks and they are definitely there and they will definitely result in a problem if they're completely left untouched.
Yeah. So let's talk about exercise because this is your
Right. Yeah,
specialty and focus of your
indeed.
research. And I'm guessing lots of people will have heard like exercise is good for your heart. Like
Yeah.
I think we hear that kind of like quite simplistic or like I guess like easy
Yes.
to
Yeah.
remember a message. But can you tell us a bit more about like how exercise impacts heart health and
Sure.
also kind of if there's a difference between which types are most effective? So I know you mentioned in your research you're looking at high intensity.
Yeah.
Um, so what's the difference and like how would we categorize that, I guess, as
Sure.
well?
Yeah. So I think the main effect of exercise on heart health is the fact that it helps control, is the key benefit is that it helps control some of the risk factors.
Okay.
So in fact, it probably helps control all of the risk factors, except for the, specific genetic ones. So the main thing that exercise does over time is that it will lower your blood pressure. It will
Hmm.
improve your blood pressure control. It will help to increase the healthy cholesterol, your HDL cholesterol, and will help control your triglycerides, both of which are implicated in development of heart disease. Understandably, obviously, exercise in combination with good diet helps maintain your healthy weight. It
Hmm.
also lowers your risk of diabetes because what it does is that it impacts the muscles and tissues' ability to be sensitive to insulin, and therefore there's less sugar floating around in your bodies. Exercise also reduces inflammation in the body, and high levels of inflammation are also associated with coronary artery disease. It also supports the function of your endothelium, and endothelium is the inner linings of the heart vessels. So it essentially improves the artery health itself, reducing your
Okay.
risks of hypertension and heart disease in the future. And undoubtedly, what it also does is got a really good impact on your mental health
Mm.
and helps promote good routines, but also reducing stress hormones, promoting those happy hormones, and all of that definitely contributes to an improved cardiovascular health. In terms of the types of exercise, so you're right in that we are investigating the effects of high intensity interval exercise. This is your typical HIIT type thing. If you're a gym goer, you'd know what that means.
Mhm.
The usual NHS recommendations are to use moderate intensity exercise, and that's a very global and blanket prescription for people with either health or poor health. Um, I think the main thing to sort of say about exercise is that the combination of different types of exercises is probably the most
Okay.
beneficial. So you would want to be doing both aerobic and strength exercises in your routine. So your aerobic exercise will improve your circulation and your functional fitness, but resistance exercises and strength building exercises will help with the metabolic functions of your body. So will help with the insulin signaling, will help with your cholesterol management, burning calories, and it has also been found to be beneficial in blood pressure management.
Hmm. Amazing. Um, I guess I think a lot of people probably associate like exercise with things like blood pressure, but it's really interesting to hear about the impacts on cholesterol as well, which I would think maybe most of us would sort of put more in the diet category. So
Of
it's
course, yeah, but I think it's all about how the body metabolizes your turns over different fats and different molecules within your body. So, I don't fully understand the whole chemistry of it, but there's been certainly data suggesting that cholesterol can be improved, cholesterol management can be improved by exercise. So.
amazing. So the you talked about global recommendations. So what we hear all the time is like 150 minutes like each week, which is kind of more or less 30 minutes 5 times a week to
That's right.
briefly top it up. But is that kind of if someone was thinking, right, okay, I'm really prioritizing looking after my heart health, like is that a level that they should work towards? Like what would you say that we should be aiming for each week?
Yeah, so I would stick with the NHS guidelines. I think there are reasons for that. Some of the reasons is mainly because it's probably the type of exercise that actually a lot of people do. So moderate intensity exercise is a brisk walk.
Yeah.
So for example, if you're a person who walks to work, well, then that's your exercise. But just make yourself, maybe walk a little bit more briskly.
Hmm.
Or, for example, if you take the bus to work, then you could get off on the bus stop, one bus stop earlier, so you actually extend your distance walking to work. So, and I think the fact that it's 150 minutes of moderate intensity exercise, I think one of the reasons for that is that we wouldn't want somebody who's never done any exercise at all to suddenly go to the gym, especially if they may have some inklings of coronary disease or heart disease already. So you just
Okay.
need to sort of build it up a little bit. And if you've never been to the gym and actually you probably have got some heart conditions, it might be better to be checked out by a GP first, just to get an all clear, make sure that they're happy that your blood
Okay.
pressure, for example, isn't too high to start exercising. The alternative to the 150 of moderate intensity exercise is 75 minutes of high intensity exercise, but
Hmm.
I think that's quite hard to do
Yeah.
the sort of the start. So I think I would just stick with the 150. In addition to the strength training, which we do recommend 2 sessions in a week,
Yeah.
and that's working through all body muscles, not just a single part.
Okay. Brilliant. And then you mentioned, so within your research, like it's the impact of high intensity exercise plus, I think you said diet as well.
That's
So
right.
what else can people be thinking about when it comes to lifestyles? You mentioned some of the risk factors such as reaching and maintaining a healthy body weight and stopping smoking.
Yes.
What sort of things are you talking about to people when
Yeah.
it comes to diet?
So diet is obviously incredibly important in trying to maintain your heart health and also your weight. We follow the usual guidelines for heart health. I actually have got a really nice booklet here, which I've sort of stolen from the hospital. It's from the British Heart Foundation. It's called Eat Better.
Eat
Sorry.
better. Oh yeah, I can see that.
Oh, it's not really working very well. It's basically Eat Better from the British Heart Foundation, and it's a booklet that they produce, and you can download it from their website.
Okay,
And it's
link to
just
that.
basically a guideline about different things that you can change in your diet to improve your heart health. And the main things that we talk about are diets that are low in saturated fats, high in vegetables, high in pulses and grains, and high quality proteins, going through low amounts of red or processed meat, trying to go whole grain, try and reduce your ultra processed, trying to reduce your salt and sugar intake.
Mhm.
Um, Also, I think that a lot of people, especially younger people, don't really understand or appreciate the importance of is the impact of alcohol intake and how
Okay.
much sugar there is in alcohol and how much calories there are in alcohol. But it's not just that; it's just the overall effects that the alcohol has got on your body that are just
Yeah.
not healthy. So making sure that your alcohol intake, is within the recommended guidelines or even below, I would say. Back in the day, obviously, doctors were recommending one glass of red wine a day. We've stepped away from that because we know now that too much alcohol is bad for you. So we don't
Yeah.
want to be doing that.
Okay.
I
Okay.
think the main thing though with both exercise and diet is just making sure that you build good habits and you're not going into that yo-yo period of both dieting and exercising because that just does not work. Build it
Yeah.
within the routine and then that should help.
Yeah. And do you do anything specific to sort of help patients with that on your trial? So I'm imagining it might be quite a big change from what they used to. So is it like you start one thing and then the next, or do they sort of
That's
pick?
right. So yes, so we are using some behavioral. We've got one of our team members on the trial is a behavioral psychologist, and she
Wow,
has
amazing.
instigated suggested some specific ways of introducing these concepts to patients, and it's all about setting realistic goals for yourselves, both long term and short term. And then, as you say, exactly introducing things one step at a time, reevaluating yourself within your broader goal, and you know, trying to motivate people to achieve those small goals in the bigger picture of the larger goal. So, yes, so we are using some of those tools in our
Yeah.
trial.
What a great person to have on your team. Like it's
Yeah,
so
yeah,
it's so important, like the psychology of
absolutely.
why we decide to change or not.
Yeah.
Okay, I'm going to move on because I'd love to sort of focus a little bit more on what you mentioned earlier around like female heart health particularly
Hmm.
and how yeah, the differences, I guess, and why maybe female heart health hasn't had as much attention. So, um, many people associate heart disease, I think, not just with like older age, but with men. So why
Completely.
is this?
Yeah. So I think a lot of it is publicity.
Okay.
You would have seen, I'm sure, posters on ambulances and even in like on bus stops of a man with like a
Yeah,
belt across his chest, and
yeah,
it
yeah.
says, "If you've got chest pain, call 999." Well, that man is white, probably about 60,
Hmm.
obese, sweaty, and just looks unhealthy.
Yeah,
And that is your stereotypical cardiac patient. Um, and yes, we do see a lot of people like that, but we also see a lot of people who are
one
completely
like that.
not like that.
Hmm.
Women, older men, older women, younger men, much younger women. It comes in all sorts of flavors, but this is the image that sticks with people,
Yeah,
and it's the image that people don't associate with. And if you don't associate yourself with that image, then you're not going to be thinking about this in yourself.
yeah,
So you know, cardiovascular risk factors are probably more common in men. So it's your smoking, your poor diet, your lifestyle, high blood pressure, high cholesterol, all associated more with male sex. But these risk factors, they are all the same in women, and actually in women, they're probably more detrimental to your health.
okay.
And actually also in women, particularly after the menopause, you start losing the protective effects of estrogen on some of those risk factors. So then your risk accelerates even more. So that's one that would be one of the reasons why we think about it being a men condition. But also the other thing is about the symptoms of cardiac disease. So a lot of people um, associate or rather don't associate symptoms of chest pain. Women don't particularly associate symptoms of chest pain with heart disease.
Hmm.
Um, and even doctors as well, actually. Sometimes women may present in a non-classical way. So, for example, might present with breathlessness or nausea or fatigue or palpitations, and it doesn't really ring the same alarm bells as it would
Okay.
do for a man. And then, unfortunately, I think there's been sort of a historical focus on male health, and a lot
Hmm.
of that is stemming from um, medicine being male-dominated profession back, 60s and 70s. It's coming through now, of course. There's more currently in the UK. There's more female doctors, I think, than male doctors. But it's not like that in cardiology. In cardiology in the UK, only 13% of cardiologists are female. We are
Mm.
the lowest three countries in Europe in that respect, which is really quite showing. Interventional cardiology, which is my specialty, so looking after people with coronary artery disease, only 8% of consultants are female. But
Wow.
as actually also very importantly, academic cardiology, so people who are consultants who do academia or research, 6% are
Mm.
female. And that is so important. So back in the day, all of the research, so it also goes back to the 60s again in the US. There was a big trial. It wasn't a trial, it was a medication that was being used for morning sickness called thalidomide. I don't know if you've ever heard about
Yeah.
thalidomide, Laura. So it's a medicine that was being used for morning sickness that caused severe birth defects in babies. So they had quite a lot of deformities of arms and legs. And after that, the FDA, so the authority in the US that regulates medical trials, have said that women of childbearing potential are to be excluded from medical trials. So
Mm.
then for 20 years on, and even actually going into now, there's been no women in trials of cardiovascular medications or any medications. So that just had a profound effect on how development of new medicines
Yeah.
was being investigated, and it's translated to where we are now, unfortunately.
It makes me feel really angry.
Yeah, I know, quite. I mean, it was done for a good reason, but the
Yeah.
way it was being managed was not very, very good.
Yeah.
Um,
And it's,
yeah.
yeah, I mean, across, you sort of mentioned earlier around, menopause and the fact that, with as your estrogen levels drop with menopause, that, that means that your cholesterol levels can rise because you don't have that protective effect. And even, I think menopause we're talking about a lot more now, but this is pretty new. I sort of think going back 5 years, like we wouldn't even have been having these conversations. So
No, completely
it's
not.
really good. But yeah, we've got a lot of like, I feel like there's a lot of
I think
time.
we've got a lot of catching up to do. I think this
Yeah.
is the sort of, I think medical profession overall has been taking more attention to women's health generally, more recently, but there is lots of catching up to do. I mean, menopause is one thing, but the other thing that we don't really ever appreciate, I wouldn't say ever, but I think one thing that's really underappreciated is the effects of pregnancy and the effects of
Okay.
disease in pregnancy on cardiovascular health.
Okay.
So for example, if you've had hypertension in pregnancy, or if you had gestational diabetes, so that's diabetes in pregnancy, or if you had preeclampsia, all of these conditions are associated with a much increased risk of developing cardiovascular disease. And actually, so if you had any of these complications, your risk of cardiovascular disease over the next 10 years increases by between 25 to 50%.
Wow, that's huge.
Huge. And
I've
um,
never read that. I've never like
no,
I've never read that before.
well, I think a lot of that is sort of filtering through general practice and making sure that these people do then have to come back, for regular tests if you've had diabetes, just to make sure, gestational diabetes, to make sure that you haven't developed new onset diabetes when you're not pregnant anymore, or
Yeah.
that you look after your hypertension. But we're talking about 20-year-old women, for example,
Yeah.
who wouldn't necessarily be thinking about checking their blood pressure when they're 30.
Mm.
So there's just lots of myth busting that needs to happen, unfortunately, and lots of knowledge and improving knowledge to make sure that women's health is appreciated more.
So can you give me, yeah, what other, I guess, like common myths are there about heart disease in women? So it isn't just a men's issue, like it is something that we need to be thinking about early. What else, like what other common myths do you come across?
So I think the main thing for me is really that women are thought to be protected from cardiovascular disease
Okay.
with the effects of estrogen. And to some extent, that is probably correct, but you're not going to counteract the effects of smoking and high cholesterol, hypertension by just having periods, to put it crudely, really. I think there has to be an understanding that cardiovascular disease is the biggest killer of women, but there's lots of publicity going on about other woman-specific conditions, for
Mm.
example, breast cancer. So you don't hear on the radio adverts directed towards women to go and check your cholesterol or go and check your high blood pressure.
Yeah.
But there's constant reminders about making sure that you examine your breasts for completely good reasons. And I wouldn't say
Mm.
to anyone, don't examine your breasts in favor of, looking after your cardiovascular disease, or lots of reminders about going for your smear tests. But
Yeah.
actually, when you look at statistics, women are twice as likely to die from heart disease than to have breast cancer. So
Wow. Okay.
you really do need to be looking into the whole picture and appreciate the whole thing. And of course, breast cancer screening is really important, as is cervical screening. But actually, the biggest killer of women is cardiovascular disease.
Yeah. So I'm already like just writing down some action points for us all. But um anyone that hasn't had their cholesterol checked, like to go and get their cholesterol checked. I'm just thinking, even like with myself, like I guess through work and other activities, it's actually probably been maybe like 5 years since I've had mine tested.
Yeah,
My blood pressure kind of more recently because I was pregnant, and
yeah.
then after pregnancy they check it as well. So, but yeah, so what age should we be checking our
Oh
cholesterol,
gosh.
our blood pressure from?
I think I wouldn't really want to put a date on it or an age, because again, all of that is being held within your overall picture. But I think it's good to have an idea about your blood pressure for sure
Yeah.
from about 25, 30, I would say.
Okay.
And I personally would quite like to know my cholesterol from about age of 30, just so I know where I am. It
Yeah.
doesn't necessarily mean that I need any treatment for it,
Yeah. Just to
unless I
know your
start
numbers.
hitting specific numbers. But I'd quite like to know if I'm in the sort of higher group or if I'm in the lower group. If my parents, for example, had cardiovascular disease, well, that might put me at a higher risk, for example. So these are just conversations that are useful to have with your primary physicians, with your GPs,
Yeah.
look at things. Um, Smoking though, smoking just has to go.
Mhm.
That's the key thing for me, really.
Brilliant. Thank you. Okay, so then thinking about just women and heart disease and our like relationships with our, I guess, our GPs or other healthcare professionals, what can we do to advocate for ourselves when it comes
I
to heart?
think so. I think the key for me is something called health literacy.
Okay.
So it's where you are aware of your own health, and where you're aware of your of different risk factors and different sort of issues that might be affecting your health, and just knowing a little bit about how body works. Unfortunately, I don't think we are very aware of that on a sort of global population basis. There is very little teaching about that in schools, and people just don't really take it as a priority, unfortunately. But actually knowing how disease develops and what is important to trying to stop the disease from developing is really, really important. So educate yourself about your cardiovascular risk factors, educate yourself about the women-specific issues. So remember, think about, well, but I've had preeclampsia when I had my first baby, or
Yeah.
I had diabetes when I was pregnant, or my blood pressure was slightly higher, but they never really done anything about it, or, just know about those things so that
Mhm.
they become important, in the future. And again, the importance of prevention, I couldn't understate that. Attend
Yeah.
any screening that is being offered to you. I think a lot of GP practices are starting to offer health screening tests for women and men. I think they start at the age of 40, I want to say, but it will depend on your locality. Some workplaces, so for example, the NHS do offer workplace health screenings for cardiovascular disease. So go to these, just that's the easiest way of checking your blood pressure and your cholesterol. Be proactive about your weight and fitness. And all of that just filters through to you, your GP, and to your cardiologist as a person who is aware of their health.
Yeah.
And and that way you are more likely to then have a constructive discussion with your physician.
Hmm.
Track your symptoms, notice patterns, realize that, for example, if you're having chest pains, well, then that chest pain tends to happen when you walk up a hill rather than when you sat down. Or actually, maybe it wakes you up in the middle of the night, every time at 5 o'clock in the morning. Notice those things, track them down, write them down. It's easier to say those things than to say, it's much easier to say, um, it's much more easy to understand what the patient's problem is when they say specifically what the problem is, as opposed to it's just like, oh, I just don't feel very well, doctor. And
Hmm.
then you go into that conversation like, So what is it exactly? But it's so much easier if you just say to me, I've been feeling really tired recently and I've got tightness in my chest, and the tightness in my chest is worse when I walk up a hill. Could this be my heart, doctor? Just say it. If you're worried about something, just say it. It's much easier for me to know what your concern is. And even if I think it's nothing to do with your heart, well, then I know that this is what you are worrying about, and I can just say it to you. I don't think it's your heart, and these are the reasons why.
Mhm.
But also, I think it's really important for you to, if you're having problems with getting through to your doctor, to acknowledge that difference in opinion and say, look, I understand that you might think that your symptoms can be a result of stress anxiety. I appreciate I have had quite a lot of stress recently, so yes, it could be, but I am concerned that this could relate to my heart. What tests have been done to rule these out? Why do you think it couldn't be? Just to
Mhm.
stimulate that discussion, and that discussion will be much more informed if you already know about your heart
Yeah.
and about your heart health and your risk factors. And of
Yeah.
course, asking for second opinion is completely fine. Completely fine. Nobody minds.
Yeah.
So very happy to provide second opinion and very happy for people to ask for second opinion, contrary to what I've said.
Amazing. Thank you. So I think we'll come to a close soon because I know you've got lots of things to get on with, and also we wanted to sort of keep this to about half an hour so people could sort of watch it during like a lunchtime or an evening. So I've got two more questions for you. So, what's one thing you wish people knew, or you wish more people knew about managing their heart health?
Sure. I've got two, but one we talked about already extensively, and that is the importance of prevention. So
Mhm.
important. And the other one is that I really wish everybody knew how to do CPR. I really wish people just learned about doing CPR. Um, it doesn't take long to do, and you hear that on the radio all the time, how to do CPR. Hands-only CPR is currently being mandated, well, not mandated, is currently being recommended by the Research Council. It's really easy to do. It's life-saving. Know where your defibrillator is, near your house, near your gym, near your workplace. That is what's going to save lives of your loved ones or your colleagues. Also, unfortunately, women are less likely to receive CPR than men. And that is probably, there's lots of reasons for that, but one of the reasons is because of fear of inappropriate touching, actually.
Okay.
So people feel less willing to strip a woman's bra off and a t-shirt off to apply the defibrillator pads, and less willing to press on a stranger's chest, which
Hmm.
leads to delays, and that leads to heart attacks, for example, being not treated appropriately in women, and women dying from this. So just learn some CPR. There are courses, there are videos. That's what I'd like people to do.
Thank you. I actually this morning, I put it back on my list as this morning. I think the British Heart Foundation have a new tool, which is like a 15-minute training.
Yeah,
You can just do it from your mobile phone. So I already had it on my list that we needed to link to that today.
yeah,
And I thought, I mean, it's been a long time since I've done that. So I was thinking to myself, I needed to do it. And I
yeah.
think their opening line is that doing CPR can more than double the chances that somebody would live.
Survival, yeah.
So yeah, what an important skill for us to have. Okay, my last question is where can people, like, if after listening to this, people think I do need to learn more and educate myself. Obviously the internet can be the Wild West. So
Yes.
where's your kind of top recommendations for where to go for more resources to
Sure.
support?
So my top recommendation always will be the British Heart Foundation
Yeah.
about any cardiovascular resources. They've got lots of resources about diet, about exercise, about cholesterol, blood pressure, anything that you like. If you already have a cardiovascular condition, there will be some leaflets advising you what that condition is and how to best manage it. But also, if you are going to have a procedure or something like that to be done, they also have got advice on that. They also have links to patient support groups and any sort of, they're basically a wealth of knowledge. Just visit British Heart Foundation website. The other website that I also use quite frequently is the Heart UK.
Mhm.
Heart UK is a cholesterol charity, and they have got a really useful quiz. The number of people who tell me in clinic that the diet is healthy is astounding. Um, the diet is really difficult to I would imagine there aren't many people whose diet is perfect in terms of heart health. and they have got a really useful quiz that I can't remember how many questions, maybe 16 questions, going
Okay.
quickly through different aspects of your diet, giving you pointers how to improve specific bits. So it's really important to maybe just have a look at that and see if you think that maybe there's something about your diet you might want to change. And then there's always the NHS website, the NHS UK, I think. They have got all sorts of advice, but specifically also they tell you when to worry and when to call the GP and when to call an ambulance. And I think that's quite important to
Awesome. I've made a little list of things for people to do.
know.
So check their cholesterol and their blood pressure, do the 15-minute training on the CPR. We can link to these things. And go and take the cholesterol quiz because it sounds like that's a really good place to sort of hone in on like some changes. Thank you so much. Where can people learn about your research, Joanna?
Oh, that's a very good question. We haven't really got anywhere that we sort of advertise this on. So you can Google MICROFIT,
Okay.
and when you Google that, there will be a page on Heart Research UK who's funding my trial. And in there it does explain how it does explain a bit more about the trial. But if there's anything, if you think that you might be eligible to take part in a trial, you can give the Research and Development Department at IUH at the Royal United Hospital in Bath a call. We'd be very happy to chat to you if you think that you might be eligible.
Fabulous. We will link to the MicroFit page as well. So thank you so much for giving up your time today. It's been
No
great to
problem.
talk to
No,
you.
it's a pleasure to
And
talk
yeah,
to you.
thanks, Joanna.
You're very welcome. Take care.